Chapter 3, using multi-layered COVID mitigation. So hopefully I've convinced you of the seriousness of cumulative COVID reinfections. Now the question is, what do we do about it? The first step to avoiding COVID is to understand how it spread. I feel awareness in this area has greatly improved the past year, which is a positive sign. We know that COVID is airborne. Ashish Jha, the former White House COVID response coordinator, once went as far as to say COVID is purely airborne, though the CDC says maybe only 99.9%. Early in the pandemic, people focused on droplet dogma, that we sneeze or cough and the virus falls on surfaces. So we need to use a lot of Lysol and hand sanitizer and scrub groceries and use your elbows to touch elevator buttons and not touch our mouths or eyes with our hands to avoid getting COVID. We now know that's not how COVID spreads. SARS-CoV-2, the virus that causes COVID, lingers in the air like smoke. An infected person exhales virus-laden aerosol particles, very small. They float around in the air for minutes or even hours in poorly ventilated rooms. Then someone inhales the virus deep into the lungs, and that's how they are infected. That's it. It's that simple. Don't want COVID? Don't breathe it in. All of this has been documented in the most prestigious medical journals over and over again. Now, how do we avoid serious health impacts from a highly infectious airborne virus? The key is multi-layered mitigation. This image shows my version of the Swiss cheese model of infectious illness. Each piece of cheese is a layer of protection, but it's Swiss cheese. It has holes. No layer is 100% effective, so you need multiple layers. The more layers, the lower risk of a bad outcome. The more layers, the lower number of lifetime infections, and the lower the cumulative risk of long COVID and other serious long-term outcomes. Walking through the layers, first, we need to support people financially to help them get through the pandemic. Paid sick leave, free PCR testing, a moratorium on rental evictions, great things, largely gone. Next, we need accurate data. Governments have mostly stopped reporting useful testing data, but we still have excellent wastewater data and forecasting models. So we do still have a good sense of what transmission is like. Next, keep one's contacts low, especially during surges. Use testing, stay home when known to be sick or exposed, use hybrid remote and outdoor options, wear well-fitting, high-quality masks, and clean the air. We'll go through a lot of that in more detail. Also, get vaccinated. If you're not aware, there's a new winter 2023-24 vaccine available in the US that just about everyone is eligible for. Vaccination is such an obvious step. I will devote hardly any time to it. I'm one of the most vaccinated people I know. My kids are all vaccinated. I usually rush to the pharmacy when eligible for a new vaccine. One of my kids was in the Pfizer trial. Vaccines reduce risk of infection and illness severity. But like all layers, they are also imperfect, and even a recent vaccine is no silver bullet at preventing long COVID. They wane over the course of 2 to 6 months and also become less effective against new subvariants, which tend to creep up during surges. We should be vaccinated on a more frequent schedule and developing new and more durable vaccines. As often the most vaccinated person in the room, these limitations are why I see the need for multiple layers. Okay, so next layer. Get treated if infected, fight to get Paxlovid, go to test2treat.org. That's test2treat.org, where 2 is the numeral 2. We also need better long COVID care. There are no cures for long COVID. It's basically symptom management and treating resulting diseases. It's still triage in my view. Finally, we need more attention to palliative and bereavement care for people dying and their families. We're talking about 10 to 20 million Americans bereaving, many of them children, and many who infected their parents as a result of school-based transmission. This is very complicated and warrants attention. I'll have more on that in a publication out shortly. Okay, so that was all very detailed. This is a simplified 3-step version from the Dean of Engineering at UC Davis. Step 1, source removal. That's engineering dean talk for keeping the virus away by keeping known sick and exposed people at home. Step 2, source reduction. That's engineering talk for wearing masks. If someone is sick but doesn't know it, their mask reduces the amount of virus in the air. It's not removing the virus like it would by staying home, but it's still reducing it from getting in the air. That lowers the risk. And bonus, if uninfected people are masked, multiplicative effects going on. Step 3, concentration reduction. That means if virus gets in the air, reduce its quantity and duration floating around in the air. Use ventilation and filtration to clean the air, open windows and doors, crank up the HVAC, add HEPA or other air cleaners. We'll go into that more soon. To recap, try to keep sick and exposed people home, mask up in case someone asymptomatic is exhaling virus, clean the air so any virus that manages to make it into the air gets vacuumed away. We'll go through each of these steps.